Hello and welcome to Medicalopinionasia. My name is Stuart Pack and I'm happy to introduce Straight Talk, a series of interviews with medical specialists to help you in the communities understand more about healthcare. Today it's my distinct pleasure to introduce Dato Dr Rajbans Singh, who is an internal medicine and geriatric medicine specialist. He is also president of the Malaysian Wellness Society and happens to be also the radio doctor. He appears every week on Light FM answering questions about all types of areas of medicine. But today specifically, we're going to be talking about memory loss, dementia, and Alzheimer's. Dr. Rajbans, thank you for being with us.
Thank you.
The topic today that we want to talk about is a topic that is now crossing a lot of people's minds, and that is one of memory loss, dementia, and Alzheimer's. It's something that more of us are thinking about now as we get older, of course, and with life expectancy now being a little bit better than it has been in the past. The question often comes up is, when do we expect to start losing our memory? And is it normal that we start having these lapses in memory? So perhaps one of the things we'd like to ask you about is the difference between these three. As an introductory, perhaps you could tell us a little bit more.
Yeah. I remember when many years ago I started, with my geriatric training in UK in 1994. I was actually one of the first to actually go to UK to train. And one of the things that intrigued me was that they actually had a memory clinic in this hospital in London. And I was surprised that, there's a memory clinic. So when I came back to Malaysia in 1995, I started a memory clinic in my hospital. And, it was quite surprising because though in UK there were a lot of patients, in 1995 in Malaysia, I think our aging population was not very, aged yet. To get one patient a month was something quite, we picked up a patient with dementia or memory loss. Now, after 20 years, I see one almost every day here. That's just me alone. And there's so many specialists who look after memory problems. So it is becoming a big issue. They say there are 48 million people in the world today with a disease called Alzheimer's, and because of that, I think people are getting worried. So as we get older, you start, getting some memory lapses. You start forgetting. You ask yourself, is this normal? Is this normal aging, or is it a disease process? And that's why I think a lot of people are worried about it. I do get people walking in who come and tell me, doctor, I think I'm forgetful. And they just worry because is it part of dementia? What's surprising is some of them come in at the age of 40. I tell them, no, it is not dementia, it's probably just your stress.
Yes.
So dementia is something that mostly starts after 60. Now there's a very rare variety of dementias or Alzheimer's disease that occurs below 60. This is sort of a hereditary.
Yes.
And normally you can get a history of, someone in the family has already got Alzheimer's at a young age. Now, most Alzheimer's starts after 60. Now, what is the difference between dementia and Alzheimer's? I think that's where a lot of people get confused. Now, dementia is the broad term for any memory loss. So let's say when you say someone got a headache, it could be migraine, could be tension headache, could be someone who just got high blood pressure. So there are many causes of headache. Same with the dementia. There are many causes of dementia, but the commonest is Alzheimer's. In fact, about 60-70% of memory loss in elderly is because of Alzheimer's. Now, the other 20-30% is because of what we call multi-income dementia. They get a lot of strokes and that can cause memory loss. 10% have got this sort of treatable sort of causes: thyroid, hypothyroid, vitamin deficiencies, brain tumor, some condition called normal pressure hydrocephalus in the brain. Now, these are keep treatable. So whenever someone comes with, doctor, I'm forgetting, you have to see now what am I dealing with. Is it someone with normal aging? Is it something called a new term that they discovered called mild cognitive impairment, MCI, which occurs in certain people, which some believe is a precursor to Alzheimer's, some believe that it might not be, which is a bit more benign because not all of them get Alzheimer's. Or am I dealing with a treatable cause of dementia, or is it Alzheimer's disease? and it's very important we diagnose them correctly.
Yes, yes.
Because the treatment do change,
Mm.
and if you do diagnose Alzheimer's, the earlier we diagnose, the better, because you actually today can try to slow down the progression of the disease.
To me, it still sounds a little bit complicated. And I think this is maybe one of the problems with the communities, that they also are not quite sure about this. And also, if it's starting to occur in a family, where do they go with such a problem? We've already got some questions from our viewers, and I'm wondering if I could put those questions to you, and that perhaps would help to put a lighter picture on this. The first question that we have is, as life expectancy increases, we're living longer. Memory loss may be expected as part of the aging process. But what would be considered the normal memory loss versus perhaps a non-age related memory loss? What would be the sign that perhaps it's not the normal kind of memory loss?
Yeah. Now, all of us will forget sometimes. We put something somewhere and forget, or we see someone we know that person but can't recall their name. But it's something that happens once in a while. But someone who is actually getting a memory loss is something that's becoming more common. And one very classical symptom is short-term memory loss. This is the first sign that they have things like they can ask you a question, and then a short while later they can ask you back the same question. Or they start misplacing things, which happens a bit more often.
Yes.
And not only do they misplace things, because we all say, oh, I've misplaced something, I can't find my key. Now they can't find it, they blame someone else for stealing the key, the purse or the key or whatever, or somebody else has taken that away. A very common symptom, which normally shouldn't happen so often. So short-term memory loss is actually one of the key early signs of someone who's getting a disease like Alzheimer's or dementia.
So what would be the first question you would ask somebody who comes into your clinic who feels they've got a problem? What would give you that first indicator that here we do have a problem?
And that's where it's difficult to ask the patient itself, because they themselves will not realize they're actually forgetting. Because as far as they are concerned, in fact, they can't remember they're forgetting.
So it's more likely to be a family member.
It's always the family member who will be saying, no, this is some of the symptoms that he's showing. And from there you can know that, yes, this is definitely a short-term memory loss that is more common. And interestingly, their past memories or own memories will be perfect. So you can't ask. And it's very important to realize that if you don't know, they can actually confabulate.
Yes.
You can ask someone who is sitting next to you and says, so what did you have for breakfast? They say, oh, I had nasi lemak with teh tarik. But the wife will say, no, but today you had French fries. And then you complain. But if you don't have someone there, they could be actually just telling you, and because in their mind, they just guess something that they have. So it's very important that whoever comes is always someone who should be with them.
So probably the first person you may meet actually is a family member rather than the patient themselves.
That's right. A lot of times that's what happens.
If they knew where to go and who to see.
And I think a lot of times it's the family member who tries to get some help, and they're the one who starts to initiate. But what we are seeing here is still a lot of crises. They come to us when it's already quite delayed, because most of the time they it's part of aging, or he's just stressed up, or maybe he'll get better later, or maybe just depressed. So they sort of delay the diagnosis, or delay coming and seeing a doctor. So I think anyone who is forgetting more often or more than before, they should go and get an assessment.
On to the second question that we've had sent to us. What are the key differences between memory loss, dementia and Alzheimer's? I think, Dr. Rajbans, you've already pretty well touched on it. Is there anything else you want to add on that, though, in just looking at the key differences between those three areas?
Yeah, I think the main thing is, again, that the last part of the treatable causes of dementia. That's something that a lot of times people don't realize, that if you are forgetting, you must make sure that you don't miss those treatable causes. The thyroid, the vitamin deficiencies, the simple brain tumor, or the condition called normal pressure hydrocephalus, which quite a few percent of elderly have. Very simple, that the neurosurgeon will just put in a small shunt, and actually the memory goes back to normal. So this must be, not miss. Make sure that they diagnose that. So again, when someone loses his memory, you have to get the right diagnosis and
Yes,
the right
yes,
treatment.
yes. Well, going back to root cause, obviously, is the key thing. Again, a lot of people in the community don't understand that, and again, wouldn't necessarily know where to go to get that. But I think as we go through our other questions, perhaps we'll be able to help people understand what they should be doing. The third question being raised is, what should I do about my father, who seems to have become much worse at remembering simple things? Who should I see? Do I need to go to a doctor? And if so, what kind of doctor helps patients with memory problems?
I think the main doctors that you can go and see your general practitioner, but again that he will probably not be able to tell, because you need to get more tests done. Blood tests can be done, but you probably need to do a simple CT scan. So the type of doctors that actually treat memory problems, either neurologists, geriatricians like me, or psychiatrists, these are the three doctors that probably will treat memory problems, the elderly, Alzheimer's, dementias. Now, sometimes people might not want to go to see a psychiatrist because I still find some of them got a taboo, say that, oh, I'm not mad, but it's nothing to do with that sort of illness. They can diagnose and treat you. So these are the three specialists that actually look and treat Alzheimer's disease.
Out of the patients at the moment who are presenting themselves, are the majority coming to doctors such as you?
Uh, I think a lot of them are now because I think people are a bit more aware. Also, most of the time, the general practitioners, if they diagnose someone who is forgetful, they actually refer to specialists.
Yes.
So, but number of the patients that come to me, interestingly, the children are those that are normally educated overseas,
Yes, yes.
and they understand what the geriatric specialist is about, and they are the ones when they get symptoms, they sort of Google up and then they come and see you.
So again, the awareness seems to be going through the different generations, and it may not be the patient themselves that is actually making the first move.
In fact, I think almost 90% will be the family member that actually sorts of brings them.
The next question is, can dementia be treated? And if so, how can this help families when someone is actually suffering from dementia?
I think it's again very important that when someone gets memory loss, first to diagnose the cause of the memory loss. If someone something treatable, we treat that. If it's multi-infarct, then you must make sure you don't get any more infarcts. So that's why you control the blood pressure, diabetes, the cholesterols, making medication that will prevent further strokes. So all those are important. And next one is Alzheimer's. Now, we still don't know what's the cause of Alzheimer's disease. A lot of theories, from inflammation to maybe some genetic variations or things like that. But what studies are coming up is very interesting. They find that the people, like the Mediterranean diet, for example, seems to help people from getting Alzheimer's. Physical activity seems to help. Social interaction seems to help a lot. Keeping your mind active. They find people who actually keep their mind active or more educated seem to have preserve the brain. We call it brain reserve better.
Yes.
So those one thing. Then of course getting them on medications. If you do diagnose Alzheimer's, the earlier you start medications can delay some of the symptoms and progression, and certain supplements might help. So all this is some of the things that we will want to talk to this patient and the family and get them on this program as early as possible. The later they come, the more problems of treatment and the disease progression can be more faster.
Do you think people are afraid to talk about this? Do you think people don't want to come out and say they have this problem or a family member is suffering from this problem? Or do you think that's changing?
That is one of the things I think people have a small taboo. One of the things that Alzheimer's can present with, especially from the early onset to the mild to moderate, is they get a lot of behavior problems. So one of the things they can get, angry, more irritable. They can have hallucinations. So they can actually have visual or auditory hallucinations.
Yes.
You can hear a patient telling you they can see someone sitting there or whatever. And sometimes, especially in the they're not very highly educated. In Malaysia, there's still some of these things, or people think that maybe someone has charmed them, or there's a spirit that has come into this patient, and you'll be surprised. Till today, we still get patients who come delayed to us because they first went to a temple or they went to the church or wherever because they felt it was something more supernatural rather than a disease. So I think these are some of the things that need to be educated for people to know, to understand that it's a disease that can be treated,
Yes.
but be picked up early.
Yes.
Treatments we start early.
Um, the next question, perhaps one of the last questions, is Alzheimer's. Is Alzheimer's preventable? One of my family members suffers from Alzheimer's. Does this mean that it will affect the children at some time?
Yeah. So if it's not one of the ones that inherited type of Alzheimer's, then there's no actually real risk. The only thing we feel is that you might have some genetic variations and probably the same sort of lifestyle that parents said if you have, then you might be predisposed to the Alzheimer's. But again, if you look at the blue zones in the world, the Okinawans, the Mediterraneans, the Adventists, they seem to have very low incidence of all sort of diseases, including Alzheimer's. So definitely studying their sort of lifestyle, I think, is one of the ways to look at how to prevent.
Yes.
So not only the food, but the exercise, the social interaction, the mental, the mindfulness, the spirituality. So I think this is some of the things that we can look at for prevention. Certain supplements, not very conclusive, but they say omega 3s, certain ginkgos might sort of help.
Yes.
But again, if someone has a disease, then you have to look at medications.
Perhaps the placebo effect is one that does
Maybe
that.
that does that. There are some new drugs right up to phase 3, phase 4 trials that are going on. Hopefully, those will, they say, seem to work better. So I think we have to diagnose early because if some new drugs come, and you're already part of in the system, then you might be able to use those to help you further.
Well, I think to round this off, I think the last thing perhaps I could ask you is, with everything now, lifestyle seems to be the precursor for a lot of the problems. What lifestyle changes should one make to try and be on top of the potential of memory loss, or to prevent memory loss or dementia and subsequently Alzheimer's?
So again, I think diet plays a big role. One of the theories is whether free radical damage, inflammation is one of the causes of that starts off with Alzheimer's disease. So having a diet that is very high in antioxidants, anti-inflammatory foods, I think this is
Examples? Could you give some
examples. I think
of
all vegetables. Again, like the Mediterranean, what they do, they have a lot of foods, they have a lot of vegetables, they have a lot of fish, nuts. All these are healthy sort of. Very little refined processed foods. So I think refined processed foods and saturated fats are some of the things that cause a lot of diseases. And I believe these also are very inflammatory. So probably Alzheimer's could be linked to that sort of diet.
Yes.
Exercise, physical exercise definitely shows to reduce risk of getting Alzheimer's and dementias.
Yes.
And that comes next to mental exercise because people forget there's such a thing as mental exercise. So in Japan, now they encourage everyone to play a game called Sudoku.
Yes, yes.
So one of the things it does is stimulates your brain. So you should do activities that sort of stimulate your brain, not watching television because a lot of people think that's stimulating the brain. It doesn't actually. That's one way thing. So when you have to play Scrabbles or play Mahjong or do some activity that keeps your mind active. Social interaction really shows. They find that people who are keep very close to their spouses, their children, they have good friends. Sort of loneliness is supposed to be a bigger predisposer to.
Yes.
So that sort of lifestyle, I think, is something that manage your stress.
And people who have retired, what advice would you give to them?
I say always, and even on the radio, I say this: never retire. So yeah,
Stay active.
So I think one of the things we see is that you must have a reason to get up in the morning. I think if you don't know why you're getting up in the morning, probably the maker up there will say, might as well come up. So I think one of the most important things is you must have some sort of purpose about no matter what your age. You might retire from your job, but do something that that excites you or whatever. Or you just to get so that you get up in the morning, what I'm going to do today. It's when people retire and do nothing. It's I think when all the diseases seem to come. So I say, just keep active. Have some reason to get up in the morning.
So to round this off, I think on a positive note, what you're basically saying is, one is that memory loss can be slowed down if it's identified early enough. Dementia, although it's not clearly known what causes dementia, again, the process can be slowed down. But a lot of it comes down to family members and family recognizing what's happening and taking those initial steps to actually find those preventable steps that can be taken. Dr. Rajbans, we do thank you very much indeed for this. for the listener and for the viewer. We hope you've enjoyed this interview with Dr. Rajbans Singh, and we hope that you can take some of this message back to your families to say that not everything is bad, and in fact for memory loss, dementia and Alzheimer's, it's the early steps which are important, and taking those steps when they're necessary and going to the right person for advice and help. Thank you for watching, and do come back again for another Straight Talk from Medical Opinionasia. Thank you.